Hello, everybody. This is Barry Blumenfeld, and I am talking to you from sunny Boston, Massachusetts, where it's 1 p.m. I welcome everyone in whatever time zone you're in, and welcome you to our talk today, which is New Strategies for Using Patient-Centered Technology to Improve Pain Management and Opioid Treatment. Your two speakers will be myself, again, Barry Blumenfeld, and I will do the first half of this presentation, and then I will hand off to Dr. Jerry Osheroff about halfway through. Before we get started, I wanted to thank our sponsors, the Psychiatry and Behavioral Health Learning Network, also RTI, where I am an employee, and the Patient-Centered Clinical Decision Support Learning Network, for which I am the principal investigator. A little bit of housekeeping. We will have questions and answers, and you'll note that there is a box at the bottom left of your screen where you can enter questions. We will not be answering these questions in the middle of the presentation, but we'll get to as many of them as we can at the end of the presentation. And also, for those of you whose questions we are not able to answer, we will try to answer them after the presentation. They will be passed on to us, and if possible, we will respond. Also, and very importantly, you can find a PDF of this presentation that's in the portion of your screen under the headshot. We will be referring to a lot of links in this presentation, and while we can't actually click through to those links during the presentation, in your copy, if you want to follow along, those links should be active, and you should be able, if you are in front of a computer, to click through to those links and find all the other information that we are referring to. And a lot of it is quite valuable, so I urge you, if you can, to follow along with this presentation in your own PDF copy and click to those links when it seems interesting. Additionally, you do receive credit for this program. One word of caution, do not leave before the end if you want to get your credit. You need to stay on this webinar for at least 55 minutes to qualify for that credit. So be aware of that, and if you do stay through the whole thing, you will be sure to get your credit. So, on to the actual presentation. So today's presentation is about the Opioid Action Plan. This is an effort that the Patient-Centered Clinical Decision Support and Learning Network undertook over a course of about 8 months this past year. The OAP covers future case scenarios, high-value clinical decision support tools, recommended actions, and many of those recommended actions are actions that are already being taken by organizations around the country. And I would be remiss if I didn't mention that the Patient-Centered Clinical Decision Support and Learning Network is an initiative that is funded by AHRQ, the Agency for Healthcare Research and Quality. We're thankful to them for that funding, and the information, including the grant number, is posted on this screen. Our learning objectives today. Number one, we're going to describe patient-centered clinical decision support, and I'll refer to that as PCCDS. It's not much shorter, but a little bit shorter than the full phrase, and how it can be used to address pain management in the opioid crisis. The second learning objective is to list specific steps that stakeholders have already taken to make PCCDS more widely used and valuable. And third, we will identify specific actions your organization can take to better leverage patient-centered clinical decision support to achieve your opioid-related goals. Before we get into that information, I wanted to take just a moment to thank all the many people that contributed to this initiative. They didn't fit on one screen, so I'll dwell on this screen for a moment and then also the second screen. But in total, we had over 50 people that participated in the development of the Opioid Action Plan. And so here are additional folks that participated in this. We're thankful for their contributions and for sticking with us again over 8 months during which we held meetings. So to start, for those of you that aren't familiar with it, what is clinical decision support? We have two definitions here, one for clinical decision support generally and one for a subset which we call patient-centered clinical decision support. Clinical decision support is a process for enhancing health-related decisions and actions with pertinent, organized clinical knowledge and patient information to improve health and healthcare delivery. Patient-centered clinical decision support is clinical decision support that additionally supports the care for specific patients and populations. So decision support that involves tailoring evidence to one specific patient based on their preferences, their beliefs, and their particular characteristics would be patient-centered clinical decision support. The Opioid Action Plan was divided into a number of different sections. We started by identifying a number of future vision scenarios. These scenarios are archetypes, if you will, what things might look like in the future for certain typical types of patients. We also identified high-value interventions, and by interventions we mean tools and materials that are useful for clinical decision support in the context of opioids. We identified current resources and activities. We identified recommendations, actions and activities that stakeholders are already taking, and finally, opportunities to engage and what you can do. So we'll start with those future vision scenarios. We identified 5 scenarios in total, and they're shown here in very brief diagrammatic form. We identified one that was the example of a patient with chronic knee pain, and that scenario was probably the most typical, someone who has never taken opioids before. We identified 2 scenarios for patients that are receiving opioids, one an acute kidney pain example, and one a post-surgical pain example. And then finally, we examined 2 scenarios where people are receiving opioids long-term. One is opioids for chronic pain, and one is opioid use disorder and its treatment. Now, there's not time to go into these in detail, but I will, in the next slide, talk you through just one of these scenarios. But before I do that, we also identified a number of high-value interventions. These are materials and tools that aid in pain management in opioid use disorder. I'm not going to actually read through every one of them, but let me just dwell on this screen for a moment. And as you can see, they fall into a number of different categories. Some of them are patient-focused tools. Some of them are decision support elements or shared decision-making tools. Some of them are calculators for a variety of things, like the morphine equivalent daily dose calculator. And others just present information that either the clinician or the patient would be interested in. Okay, so on to that scenario for a patient. So this is actually that first scenario that I showed you, and I'm going to talk you through this one. It'll take a couple of minutes, but it's to give you the sense of number one, how thorough these were, and to the degree that we painted a scenario that shows exactly how these interventions and tools might be used in the future for patients with these conditions. So in this case, we have a patient who's bothered by knee pain, which has been diagnosed as osteoarthritis. Her practice enrolled her in its patient portal and ensured that she was comfortable with it, so she checks the portal, and it directs her to helpful information, tools, and guidance. This includes information about osteoarthritis, evidence-informed treatment approaches, function pain evaluation tools, and a management decision guide. The patient completes the evaluation and decision guide tools, schedules a primary care appointment using the portal, and begins implementing some of the self-care recommendations that she reviewed. The portal guides her to fill in a pre-visit questionnaire about her reasons and goals for the visit. On the morning that the patient visits her clinician and her medical assistant review the pain evaluation and decision tool results. They view a summary that provides a human snapshot of the patient, her goals, her life circumstances, and attitudes. They also explore health data from the Health Information Exchange via the electronic health record. They also review the state prescription drug monitoring program for information about possible opioid prescriptions that the patient may have been taking. They see that the patient previously had an orthopedic consultation and was not considered a surgical candidate. The patient was given only minimal therapeutic options at that time, so recommending or prescribing non-opioid alternatives to pain management is a possibility. As the patient talks in the consultation room, the medical assistant confirms and updates information in the shared decision-making tool, reviews the pre-visit questionnaire. She migrates this information into the electronic health record visit note, which is generated using a documentation template. Then, during the clinician encounter, the patient and clinician review the shared decision-making tool to support therapy selection. After discussion of risks, benefits, and costs of the different approaches and the patient's values and expectations, they agree that a trial of physical therapy and topical diclofenac is the best approach, which is prescribed electronically from an osteoarthritis pain order set and documented in the plan of care. Finally, after the visit, the patient uses a mobile device, a smartphone or tablet, versions of the tools to document progress, such as function, pain, and activity levels. To support adherence to the plan and address questions that arise, these tools interact seamlessly with the practice portal and electronic health records so that the clinician, the medical assistant, and patient each have convenient methods to communicate. So that describes one arc, in this case, again, a relatively uncomplicated patient with knee osteoarthritis. And again, we did similar sorts of scenarios for 4 other types of patients, all in the interest of trying to identify the types of tools and materials that would be of use to these patients, and also the circumstances during which they might be accessed. Okay, next I'm going to talk a little bit about current resources and activities. These are things that are going on now and that you can read about. So as a springboard to the future vision, we reviewed quite a few different areas and categories of current resources. And this list shows you a partial but not total list from the Opioid Action Plan. And they include things like pain and opioid guidance for healthcare professionals, initiatives to improve opioid use, access to health IT integrated PCCDS interventions, PCCDS intervention implementation guidance, and opioid PCCDS implementation case studies. These are all available to you in the Opioid Action Plan should you choose to read the actual document. This is just one example of the first category that I read to you, patient information and decision aids on opioids. And I'll note that as you see these blue lines here, these are actually links. So in your PDF copy, if you want to, you can click through to these to actually see the information that we're talking about. And for this particular category, we found free information in multiple languages on opioids from the National Library of Medicine. We found information and resources related to opioids from the CDC. We found patient-facing websites with pain management information and resources from Intermountain Healthcare. And we also found these other resources, improving shared decision-making in osteoarthritis, towards patient-centered telerehabilitation design, understanding chronic pain patients' preferences, and also It's About Me, patient experiences of patient participation in a web behavior change program for activity in combination with multimodal pain rehabilitation. Again, if you'd like to, in your own copy, you can click through to these to read more about them. Okay, so that brings me to the end of the portion that I was going to speak about. Again, I do urge you to take a look at that PDF version of this and to follow along on your own and to click through where you would like to. But at this point, I'm going to turn over to Dr. Osheroff. Dr. Osheroff, I will add, was the first author and really the ringleader for the generation of the Opioid Action Plan, and he's going to take you through the rest of this presentation. So, Dr. Osheroff, handing off to you now.
Excellent. Thanks very much, Barry. So to just recap the terrific information that Barry just shared. So what we're describing today is this highly collaborative action plan that dozens of people came together to try to chart a path forward whereby patient-centered clinical decision support could be applied more broadly and more effectively to manage pain better and to address the opioid crisis. And all kinds of action plans have come out of all sorts of different initiatives. And in this particular one, we decided rather than just having an action plan that would wind up, getting filed away in a government vault somewhere like the Ark at the end of the Raiders of the Lost Ark movie, that we really wanted to try to drive change in the real world. So in other words, not just make a plan with a bunch of recommendations of things that other folks should do, but actually define first and foremost a highly compelling picture of what a world might look like if patients who experience pain and those who supported that patient, their care team, their caregivers, and all the rest of the ecosystem that provides resources that support those interactions between patients and their care teams. What would it look like if all those people lived in a world where everyone had access to all the information they needed, all the tools they needed, all the communication that they needed, so that that pain or that opioid use or the opioid use disorder management could unfold in the most efficient and effective, sort of quadruple aim-ish sort of way, where patient health is optimized, where costs are minimized, and where patient and care team experience are as good as they can be. So the first thing that we set out to do, actually at the very beginning of the project, was to put together a very broad group of stakeholders that would represent all the different perspectives, all the different work, all the different activities that were essential to bring about this future state. So that's what led us. I think we started with just a dozen or so people, and then as the project unfolded, we added more and more people. So the goal was, let's build a critical mass representing all the different stakeholders that are required to both articulate this highly compelling picture of what the future of PCCDS-enabled pain management and opioid use and opioid use disorder treatment would look like, and then define steps not just that other people can take, but that those stakeholders could take to move the world closer to that future state. So again, I would say that in the link, in the link to the slides at the very end of that slide, and we'll come back to that at the end, is a link to the actual Opioid Action Plan document. And I would encourage everyone, who's interested or inspired by the things that Barry and I are sharing to actually take a look at that document, and specifically to look at the future vision scenarios, because as you'll hear, everything really springs from that compelling picture that these dozens of stakeholders put together of what they collectively want to see the world look like, so that we're leveraging patient-centered clinical decision support intervention. So decision aids for patients and their care teams, order sets and things that make the right thing to do the easy thing to do, documentation tools to track all the critical data so it can inform decision-making, dashboards to keep track of everything that's going on. These are the interventions. So in this future vision, we want to see widespread and robust use of these tools, and the scenarios sort of illustrate how those tools can come to life in different situations. So what we did in this project was we identified, as you saw from the earlier slides that Barry showed, dozens of different individual stakeholders representing key stakeholder groups that are necessary to articulate this future vision and to chart a path to get there. So at the heart of this matter on these slides, the boxes that are highlighted in gray, kind of the central players in this story are patients, people who receive care, providers and the care delivery organizations that they work in that provide that care, and the health IT organizations, so the electronic health record suppliers, the clinical decision support suppliers that are providing the tools and information that the providers and the patients are using together to optimize decisions and actions that are going to lead to better pain management, et cetera. So those players are kind of at the heart of this drama, but in order to get to a future state where those players have all the information and tools that they need to have good care processes and good outcomes, there's a much broader ecosystem around those individuals that needs to be in place and working effectively. So organizations that pay for care, organizations that provide continuing education providers to prepare them to utilize these tools, health IT associations and organizations that bring together different stakeholders to identify and disseminate best practices for using health IT, for example, guideline developers, et cetera. So the point is there's a whole ecosystem of stakeholder groups, and in this project, you can see some of the bulleted items here are the names of actual organizations that participated in the development of the future vision scenarios and the recommendations, et cetera, that I'll walk through next. So the first thing that we did, like I said, is round up this broad multi-stakeholder group. Then we articulated this shared vision of what the future of PCCDS-enabled pain management and opioid use could look like. And then we set about identifying specific actions that all these different stakeholder groups could take to make that future vision a widespread and valuable reality. And as I mentioned before, the task wasn't just to make a list of recommendations of things that people could do, but actually as a part of developing the action plan, starting to take some of those steps. And I'll review both the recommendations and those steps that were already taken. So there's hundreds of people that are on this webinar right now. I think you all are would sort of fit in one or more of those earlier stakeholder categories. So as we talk about the recommendations that we came up with and as we talk about the actions that we already took, we would encourage you to think about how these things resonate with goals that you're trying to accomplish given the part of the ecosystem that you specifically work in. So the way that we set out the recommendations, we divided them into two different categories. So for each one of those 11 different stakeholder groups, we identified a critical action. So what is the essential thing that this stakeholder group needs to do to move the world closer to what it would look like if those 19 interventions were deployed more widely and effectively to make things like those 5 scenarios be very common and valuable. So for each of those groups, we identified a critical action, but a really important point here is that those actions are very much focused on those interventions and those future visions. A lot of times when people do, roadmaps or action plans or whatever, it's just sort of, it's not against as sharp a focus. And we found that in this project, saying that the action plan, the critical actions and the recommendations are focused very specifically on making those interventions and the scenarios that illustrate how they can come to life much more widespread and highly valuable. So some of these things seem obvious, but looking at these critical actions in light of those specific future scenarios, which is what these organizations did, and when I show you the actions that they've already taken, it sort of brings some of these high-level things that seem obvious into sharp focus because they actually started to happen. So for those who provide EHRs and clinical decision support tools and other kinds of health IT tools, those organizations obviously need to provide these interventions, those 19 interventions as they're described in the roadmap, and make sure that those interventions are in fact usable and effective. Patients and their advocates need to use those interventions independently, so when they're going about their daily activities in their daily lives and when they come together with their care teams. Those who provide care and the organizations that they work with need to deploy those interventions in their environment, and the care teams need to use those interventions successfully as a part of their daily activities. Those who supply guidance, so the CDC has guidelines on opioid use, and many other organizations do as well. So the organizations that supply that guidance need to develop and enhance that information in ways that it'll inform the interventions that underpin these scenarios. Health IT associations can foster best practices and collaboration among their association members to make it easier to realize those future vision scenarios. Payers can fund providers to procure and implement the tools that they need to develop and implement the workflows that are required to bring those future vision scenarios to life. As we said before, the providers, the care teams that are delivering this care need preparation to understand these new workflows and implement them, to understand the intervention. So continuing education providers need to ensure that these care teams appreciate the future scenarios and are motivated and prepared to actually implement them. Organizations that conduct research can drive and coordinate their efforts so that to provide, again, the strategies and the insights that are necessary to actually execute successfully on the future vision. State and local agencies can partner with care delivery entities and others in their region that can foster the successful implementation of these PCCDS interventions. So that these interventions are interoperable and can be developed and implemented more easily. Standards organizations need to make sure that there are standards that are available to develop and use these interventions. And we included recommendations for the learning network itself to basically leverage its mission and activities in the 4th year of that cooperative agreement, which is this year, to foster the execution of this action plan. So the Opioid Action Plan goes into more detail about specific recommended actions for each of those 11 stakeholder groups. I'm not going to go over all of them in detail. I'll give you a sampling of what those more detailed recommendations backing up those critical actions, what that looked like for 3 of those 11 groups, just so that you can get a sense of what some of the more specific suggestions were about next steps to make those future vision, the future vision scenarios widely deployed and highly valuable. So starting with patients and their advocates, these future vision scenarios, and perhaps even the 19 interventions themselves, was just a preliminary sense. Again, there were dozens of people that were involved in synthesizing this, but the sense all along was the publication of this Opioid Action Plan wasn't the end of the road. It's very much the beginning of an even broader ongoing dialogue to enlarge the group of people that share this vision about what PCCDS-enabled pain management and opioid use and opioid use disorder treatment, what that could look like, what that should look like. So from the patient perspective, having them on an even more broad basis participate in further refinement and vetting of these future vision scenarios to make sure that it fully aligns on an even broader basis. We had quite broad patient stakeholder input in this process, but in reality, we only scratched the surface. So there's a lot more broad vetting of these future vision scenarios, refining them, extending them so that they really fully capture patients' healthcare experience and outcome goals. And then the next thing that patients and their advocates can do is actually begin to expect and demand that these vetted future vision scenarios become the standard of care. So rather than just tolerating, a lot of the inefficiencies and issues with the care delivery as it currently exists, as many patient advocates currently do, they sort of are advocating and demanding a better state. And these future vision scenarios, especially if they're further vetted and refined, provide a concrete set of things with regard to related to the opioid crisis, a specific set of things that can and should be demanded. And then it's clear from just the critical actions that I outlined that there's a lot of different steps that many different stakeholders need to take in order to get to that future vision. And as a sort of a famous patient, engagement statement goes, nothing about me without me. Patients really should be active participants in all the things that all the stakeholders are doing to ensure that the net of all that is in fact a world where things are getting better for the patients, especially as sort of the central actors in this whole story. So some recommended actions, again, to just give you a flavor for some of the greater detail, the recommended actions for health IT and clinical decision support and EHR suppliers. So likewise, they also can participate with their clients in further refining the future vision, describing how offerings that they currently provide help realize that future vision, cross-fertilizing their implementation success strategies across their client base. Many or most EHR and CDS providers do these sorts of things already, but with the sharper focus of the future vision, it provides a more concrete destination to help their clients get to. They can improve the intervention use and usability by participating in work groups such as CDC's Adapting Clinical Guidelines for the Digital Age Initiative. They can collaborate with each other, with other health IT suppliers, as well as others to provide the standards-based interventions that are interoperable across delivery platforms. They can support continuous improvement via mechanisms for structured reporting on the use and results for specific interventions. So it's not enough to just put the interventions out there. We need to understand how they're being used and what's working well about them and what can be improved so that we can drive a continuous improvement process. And then importantly, they can also be transparent throughout the CDS lifecycle, how the development decisions, how these tools are integrated to facilitate trust, to apply design thinking and related person-centered problem-solving approaches to ensure that the tools that these suppliers produce do in fact improve workflows and information flows and satisfaction and all those other things. So then, again, to just say a few words about sort of the third actor in the core triad of stakeholders to bring about this future vision, looking at providers and care delivery organizations. So one of the things that we saw, in this project by pulling together many different stakeholders, that some of those representing care delivery organizations had already developed a lot of successful tools. William Gibson said the future is here, just unevenly distributed. So we found pieces of the future vision distributed today in certain care delivery organizations. So having those who are already having some success and who are experiencing some of this future vision share their strategies and tools with others. And that process actually began as a part of developing this opioid action plan, but there's a lot more of that can and should be done. So that's one of the key recommendations for providers and care delivery organizations. And then, sort of all those, everybody, not just the folks where the future is represented, but everybody who's working on trying to do a better job with pain management and opioid use disorder can review the kinds of success models that we've illustrated in the future scenarios, tap into the work that's being done by others so that people aren't toiling in isolation trying to figure out how to leverage patient-centered clinical decision support to address this monstrous challenge. And then, again, those who are at the forefront of care delivery can identify sort of their most important problems to solve, a number of which are presumably listed in some of the other recommendations, and actually engage very actively, as we recommended for patients, with these other stakeholders in bringing about the solutions to those problems or challenges. And then again, echoing the statement that I made before about the health IT suppliers, measuring the success that's resulting from the interventions and their implementation to foster this continuous improvement environment. So as I said earlier, so what I've just shared with you is a quick overview or a sampling of what some of the recommended actions are from the action plan. And that's sort of the centerpiece of what action plans typically are about, a list of things that people should do in order to make the world a better place. As I said before, a critical focus of this project wasn't just generating that list of recommendations, but a critical part of what we tried to do from the very outset in how we brought people together, in the kind of conversations that we had, in the work that we did, was to go way beyond just developing the list of recommendations and to start to actually drive changes in the real world. Ideally, in each one of those sectors, in each one of those different 11 stakeholder groups, try to start making things happen that would bring that future vision closer to reality. So we put quite a bit of time and attention into trying to make that happen. And one of the things that I'm most proud of in this action plan is the section where we describe, where we gave examples. And there are a couple dozen examples of how the process of developing the shared vision of what the future could look like, what the key interventions needed to be, and some examples of how those interventions came to life, steps that people actually took in the real world to make that future vision closer to reality. So what I will do now, I'm not going to go over every one of those things, but I'll share with you what the categories of actions that people took were and give you sort of a sampling of what some of those actions are. And then once again, to sort of tee up what hopefully will be, you know, some things that we can respond to at the end, and we're going to ask you to actually share examples if there's things that you're already doing along these lines or ways that you can leverage the Opioid Action Plan. We would love to hear that from you. So as I walk through these actions that were taken, I would encourage you to think if any resonate with things that you have done or things that you could potentially do, or if there are things that are missing, actions that you might be able to take to bring these future visions, which hopefully you'll look at in the full Opioid Action Plan and the interventions, much closer to reality. So the first category of actions that the development of this action plan stimulated was the notion of creating enhanced interventions. So, you know, we outline these 19 interventions, and to one degree or another, or to some extent, these 19 interventions are happening today, but they need to happen much more richly and on a much more widespread basis. So in this category of actions that already started happening, it was the idea of creating new and better interventions to fully meet the criteria described for those interventions so that they could implement the components of the future vision scenario. So within the theme of creating these new and better interventions, here are several things that happen. Again, this is just a sampling. So 3 of the EHR vendors that participated, staff from those vendors that participated in the development of this action plan, specifically Epic, Allscripts, and Meditech, are using the future vision scenarios. So while we were putting, you know, the final report together after we had developed the interventions and the scenarios relatively early in the process, these vendors started sharing this future vision with their product development teams to sort of give them a concrete picture of, in the pain and opioid space, the kinds of things that they wanted their tools to be able to provide. So in that way, this future vision is actually helping to spur innovation in these organizations by providing this concrete picture of the future. There was staff from a clinical decision support supplier, EBSCO, who was very active in this project. And as we started describing tools that were needed to support evidence-based patient decision-making from scenario 1, which Barry briefly outlined, it was clear that there was a need for a patient-facing decision aid, the likes of which didn't exist. So as a result of participating in this opioid action plan development, before we even published the action plan, this clinical decision support supplier actually built this patient-facing intervention. And there's links in the opioid action plan and in these slides where you can actually see, get a picture of what that decision aid might actually look like. And then similarly, we had that clinical decision support supplier and an EHR provider and a care delivery organization were interested in piloting, and they began during this development process, the OAP development process, to actually implement that tool in that environment using FHIR, again, to bring that first scenario closer to reality with the combination of those assets. There was another large health system, academic medical center, that had a participant in the work group who sort of brought those scenarios back to that organization, and they are leveraging those future scenarios to underpin or to inform the CDS support architecture for pain and opioids as they move forward there. So those are just a couple examples of how the development of the Opioid Action Plan and the future vision scenarios in particular spurred action toward creating the kinds of interventions that the document called for. Another category of steps that were taken were, again, to the extent that the future is here, just unevenly distributed. So there are examples of some of capabilities within those interventions that exist today. So the idea of how do we make those interventions that exist today used much more broadly. So, for example, the EHR Association, they have an opioid crisis task force. That's an organization for EHR suppliers, and they developed a guideline for EHRs how to implement CDC's opioid guidance in those EHRs. So the task force that developed that guide agreed to sort of consider developing follow-on guidance to describe how these EHRs can more fully address the future scenarios from the Opioid Action Plan. There's a group called the Conjoint Committee on Continuing Education, which is a multi-stakeholder group that is responsible for developing blueprints and supporting implementation of continuing education activities focused specifically on pain management and opioid use. They participated in the project, and they're exploring ways to leverage those future vision scenarios in pain and opioid-related continuing education to provide that support function that I described on that stakeholder slide. There are a bunch of provider organizations that are using the future scenarios to inform their pain and opioid-related CDS efforts. In other words, how can they leverage tools that they have available today to make portions of those scenarios come to life? There's a quality improvement organization that's one of the 13 CMS-supported QIN, Quality Improvement Network, quality improvement organizations that's using those future vision scenarios to inform their technical assistance activities and planning, again, to help those that they support implement pieces of that future vision that's outlined in those scenarios. So again, that's just a sampling, a small handful of the larger number of steps that organizations and stakeholder groups started taking to implement the Opioid Action Plan while we were actually still developing it. So the Opioid Action Plan was published, I think, back in April, just sort of a few months ago, and now the question is, what happens next? So the Patient-Centered Clinical Decision Support Learning Network that Barry mentioned that he's the principal investigator for. It's a cooperative agreement. That cooperative agreement ends this year, shortly after the end of this year. So, and this year we're not focusing specifically on executing this opioid action plan. So a critical thing that we need to deal with in publishing this action plan is to try to get at the issue of what happens next. What are some next things that can happen? We already started generating significant momentum toward the execution of this action plan as we developed it, as I just described, but we really didn't want that to be the end. So the idea is what kind of things need to happen next so that all this great work that all these people did can continue to grow and snowball and have broader and broader effects beyond the significant but admittedly limited initial effects that we were able to generate. So what we're going to talk about next is some of the things that we recommended in that opioid action plan to continue this work and to build on it and to sort of close out by bringing us back to what does all this mean for you, for the hundreds of individuals that are on this webinar today. How can you leverage what we've done to accelerate the things that you're trying to do? So one of the central things that came out of the discussion when we started saying, okay, well, we developed the future scenarios, we identified the critical actions and the recommendations, we actually started taking some of these steps. Everybody was very excited about this, but as sort of a wrapper on this action plan, where do we go from here, especially given that, with the generous federal support through ARC that supported the creation of this thing, because there wasn't ongoing support, what can we do to try to breathe ongoing life into this so that it would continue, that this effort would continue to build and expand and hopefully grow into something that has, really, really substantial impact on a very widespread basis. And the key underlying theme of what that most important thing is to get this, rather than to sort of end like the Raiders of the Lost Ark, where the Ark sort of gets filed in the government warehouse, which already has not happened, but to really have this work give its full flower. The key thing that everybody agreed needed to happen is we need to have a way to build on these actions going forward through ongoing collaboration. The short answer was all sorts of magic had happened by bringing these people together to having a forum where they could do all the sorts of things that I described, to do new research projects together in an interactive way, to develop new products, to do other sorts of things like that, that there needs to be this ongoing forum, which does not exist right now. So I'm not going to go over these in detail, but what this slide and the next few slides show is just these different stakeholder groups identified what the specific value proposition to them would be from this ongoing collaboration to do the sorts of things that we already started to do to execute this action plan as we were developing it. So again, so that we can get to questions, I'm not going to go over these in detail, but to just say that we did identify specific ways that such an ongoing forum, should someone provide one, and we're actively looking for someone to do that, the value that would bring to the different stakeholders. So if any of the 600 or so of you have specific ideas for doing this, we would absolutely be thrilled if you would enter that in to the questions. So again, as a lead-in to the Q&A part of this talk, so what does all this mean for you? So this other group of people came up with these 19 interventions, that patient-centered clinical decision support interventions that could transform how we manage pain, how we use opioids, how we treat opioid use disorder. We came up with these scenarios of what it might look like to put those tools into play for the various scenario types that Barry outlined. We made up these recommendations for different things that people can do, and presumably every one of you fits in, at least one of these different stakeholder groups. What does all this mean to you? So I would say that given the previous experience, just looking over the scenarios, looking over the 5 scenarios, particularly the ones that are the most relevant to your circumstance, think about the extent to which that reflects a compelling and valuable future state. Could that help you focus and institute change, whether you're a patient, whether you're work at a federal agency or a state or local agency or a care delivery organization? Can you use those future scenarios in the ways that other participants in this project in developing the Opioid Action Plan did? Can you do similar things to leverage those future visions? Can you apply the recommendations and the actions already taken? Can you adapt those to address things that your organization is trying to do? And we would love to have you give us feedback, and I'll give some more specific questions on the next slide. If you're already doing work in this area, if you have ideas about what might be an appropriate ongoing forum for this work, we would love it if you would chat that in. And I would mention that there is a related AHRQ initiative called ACTS, which stands for the ARC Evidence-Based Care Transformation Initiative, and there's a link here where you can learn more about that. It's sort of another multi-stakeholder effort focused on addressing the quadruple aim even more broadly. And without getting into any details, I'll just say that pain management, opioid use, and opioid use disorder figure prominently in a future vision that we're creating as a part of that broader picture, and the Opioid Action Plan itself figures into that work as well. So that's sort of one example of some follow-on activities that are happening here. So some of the things that we would love to have you type in questions about are, does work by you or your organization represent steps toward implementing this action plan? If so, we'd love to have you type that in to the question box, because identifying, connecting these efforts could be key to accelerating progress. And then similarly, this is sort of a loose ball right now. There isn't any organization that sort of has ownership of next steps in executing this action plan. So if you have any ideas for making that happen, again, please type those in. And if you type things into the question box along these lines, please give us some sort of context so we can understand what exactly you mean, because if it's something that's disembodied, it might not be clear what exactly you're saying. So that brings us now to the Q&A. We have 10 minutes for that, and I'm supposed to remind everybody not to leave this page. As Barry said, if you sign off before 5 minutes from now, you will not be able to get your credit for this talk. So with that, and again, the last slide I would just mention, there's links to the Opioid Action Plan. If you want to get in touch with Barry or I or other co-authors, et cetera, you can click here. So with that, let me turn things over to Barry to launch us into the Q&A.
Well, thank you, Jerry. And there are quite a few questions here. So why don't I just start reading a few of them to you. Some of them I may take, and others I may just hand off to you, especially the hard one. So the first question, how can a pain management physician get access to those forms? I think I'll take that one, Jerry, and say that the action plan, as you know, there are links. The final slide has a link to the full action plan, and there are links in these slides as well that will take you to some tables that actually direct you to the various organizations and sources for a lot of the forms that we've referenced, or for a lot of the materials that we've referenced. So I'd urge you to get the full text plan, browse it, and it's really got a wealth of information in there that you can click to. Anything that you want to add to that, Jerry?
No, that's good. Why don't we move on?
Okay, and then there's a question that said, Appriss Health is an important health ID player with their in-workflow NARCS care solution that they have great tools to assist with clinical decisions. Is there a reason they nor PDMPs are identified as important health IT contributors? Both seem to be extremely important contributors. I'm actually not that familiar with the Appriss Healthcare solution, and Jerry, I'll hand off to you in a minute in case you are. But with respect to PDMPs, they are most definitely identified as important health contributors. And again, what we've shown you today is just a quick flyby of what's in the full report. And there are several links to, and there's quite a bit of information about PDMPs in the report itself. Jerry, are you familiar with the Appriss Health solution?
Not enough detail so that I could be sure I wouldn't embarrass myself by commenting on it. I think so. The point that I would make at sort of a higher level. So if the question is, well, it didn't seem like X, Y, or Z was covered in the Opioid Action Plan. So with the resources that we had and with the time that we had, the idea was not necessarily to include every single thing in here that could be included. The focus was more on starting a conversation and bringing people together to start laying out a shared picture of what the future would look like and start the process of identifying steps that it would take to get there. So there wasn't, things weren't necessarily purposefully admitted in any case. The idea here was to start a conversation, to start a ball rolling. So to the extent that anybody feels that there are things that were omitted or that need to be covered in more detail, that's fantastic. And our goal was to start a conversation to bring people together to do exactly that, to say, well, what about this or what about that? And to incorporate that into this broader multi-stakeholder conversation. The challenge that we're facing is there isn't an entity, there isn't a forum for that conversation right now. So what we really need, sort of the most important thing to have to be able to address these issues, is to have that forum where people can ask these questions and have that conversation, but that does not exist right now.
Thank you, Jerry. There's a question, how well does the opioid decision tool work for patients using their mobile tablet or smartphone? Are any problems encountered with the use of this tool? Well, there's two answers to this. One is the Opioid Action Plan itself, which again is accessible on the web, can be viewed on a mobile phone. It's really just viewed through your web browser, and so you could view it on your phone or on your iPad or whatever other tool you were using. But there's a kind of a double layer answer to that, because there are many tools and many resources that are available for you to click through to that are actually contained in the Opioid Action Plan. And while most of them are probably usable on a smartphone, most things available over the web these days are, it is actually those sources that will determine their full usability over a smartphone or a tablet. Anything to add to that, Jerry?
Yeah, so I actually interpreted the question differently, and I tried to move to another slide, and somebody just moved me back. So what I thought was that somebody was saying, when you say the opioid decision tool, what I thought that might have meant was somebody trying to say that the action plan was about a single tool that somebody used, and the question was, can that tool for supporting pain management or opioid use, is that tool available, you know, on a mobile tablet or a smartphone? And I wanted to go back to this slide to sort of reinforce. I know we went over all this very, very quickly. So the Opioid Action Plan doesn't speak to a single opioid decision tool. It actually refers to 19 different tools that are listed on this slide. So, and in the scenario that Barry showed, all that bolded text is actually in the Opioid Action Plan document. That those bolded items in the text link back to these specific tools. So in the Opioid Action Plan, this future vision that we're trying to bring about, it's about how to make all these 19 tools more robust, more powerful, so that they do a better job of supporting decisions, actions, and communications. And if that was the question, then absolutely, within the Opioid Action Plan, the notion was that to the extent that smartphones or tablets or any other kinds of channel for delivering information, that would be fully leveraged in this future state. So I just want to be clear that the Opioid Action Plan isn't about one single tool. It's basically about these 19 different tools, and those tools don't exist fully today. They may exist partially today, and the idea is to get them to exist more fully and be used more broadly and effectively.
Well,
Barry,
while you're... Yeah, one more question. While you're on that tack, Jerry, the question was, how can providers gain access to patient-centered clinical decision support tools to better manage pain and opioid use disorder? And while you're on these interventions, you might want to add a little bit about that.
Yeah, so that's a really important question, and that's actually one of the things that the Opioid Action Plan calls for, and something that could be accomplished through this ongoing forum. So there were examples where some of the care delivery organizations had developed these very robust tools. They were willing to share those robust tools with others. So one of the things that we recommend is that there needs to be a repository associated with the forum where people can share these tools. So that does not exist right now. In the absence of that, I would refer you to the material that Barry covered. So in the current state section of the Opioid Action Plan, we give examples of guidance. There's some resources there. We give some examples, a sampling. Again, this was not a comprehensive environmental scan, but there's a sampling of specific patient-centered clinical decision support interventions that underpin those things. So I would refer you back to the Opioid Action Plan, to the current activities section, and there are links to a bunch of things there, and hopefully we'll find a way to stand up this forum, which could represent theoretically a one-stop shop where people could go for all these various resources. Okay,
well, Jerry, we're almost out of time. We have about 40 seconds left, so I don't think we have time to get any more questions in. I do want folks to know that if we were not able to answer your question, and there were a number of questions that we were not able to get to, that we will try to follow up after this seminar with answers to those questions. And with that, I will say thank you very much. We were very happy to be able to present this information to you today. And Jerry, if you have any last words, I'll let you get the last word in with 5 or 6 seconds left.
Thank you, Barry. Thank you to all the attendees, and thanks to RTI for putting on this session.
All right, everyone. Have a great day.